All right, this is the last, sorry, section for today. We are going to get into the impact of physical activity on skeletal and mental health. And then once we wrap that up, I'm going to post all these to Blackboard. You're going to have to do your homework too, which is going to be on Blackboard as well, and your Unit 1 exam on NCFS. If any of you had any trouble getting that, let me know. Um, and then I'll get that to you. All right, let's get right into it. Mhm. Can't see anything. Okay. Okay. Impact of physical activity on skeletal and mental health. Our learning goals for this section is identifying the impact of physical activity on osteoporosis, understand the role of load-bearing exercise in maintaining bone and mineral density, identify the impact of physical activity on osteoarthritis and rheumatoid arthritis, identify the impact of physical activity on mental health and depression, identify the impact of physical activity on brain health and neurodegenerative disorders. So osteoporosis. So on the right, you'll see a picture and you'll see how normal bone is supposed to look like. And then you'll see under that what osteoporosis looks like. So it's a little degeneration. It's progressive. And then some your bone mineral density. So that's going to be a big acronym that you're going to see over and over again. It starts to deteriorate over time so that tissue of your bones start to get very brittle. And obviously, you're going to have the risk for fractures, and some of those common sites are going to be hips, wrists, your spine, and shoulders. And it's mostly common among women, and especially after menopause. So, osteoporosis and your bone mineral density, you can see how females are going to have a lower peak mass than the total mass of the calcium in their bones. Obviously, males have more uh, density in their bones than females do, but we are going to peak at around the age of 30, while men peak at around 42. From there, it's a downhill slope. Obviously, as we age, that bone mineral density is going to lower. There's a huge dip in women at around 55, and that's due to that menopause. So, physical activity and osteoporosis. So, lifts that load the axial skeleton. So, that axial load is going to be that downward force. So, when you have the like example here, she's squatting with the barbell on her back, that's going to give a good axial load on the skeleton and it's going to put some good stress on the bones. That's going to benefit bone mineral density. So, back squats, military presses, deadlifts, lunges. Um, Having good vitamin D, calcium, and doing a lot of these load-bearing physical activities across your life can help defend against osteoporosis. So arthritis, we have osteoarthritis, which is common in older age and obesity, and there's various causes. So it's a degeneration of joint cartilage, and the underlying bone is commonly associated with previous injuries. Excuse me, obesity and sedentary behaviors. So there you go again, just like not being physically active is going to put you more at risk there. So pain, stiffness, immobility, sedentary behaviors, um, will cause osteophytes. So this is a bone outgrowth. deformity that causes pain and surrounding nerves and muscles. So putting any bone around that is going to cause more pain. And then you have post-traumatic arthritis. So this is about 12% of cases. So this usually happens after an acute injury. So if you just hurt yourself, like an injury, just like you bumped your knee or something, or you sprained something in your knee, this can cause the injury to that joint and cause arthritis. And then rheumatoid arthritis is basically like an autoimmune disease. So this happens and it gets pretty bad. So it'll debilitate or cause some deformities in your joints. This would be a chronic progressive autoimmune disease that causes severe joint inflammation, painful deformities, and significant immobility over time. And this usually you'll see this older people that have like really big like bumps on their fingers, sometimes their wrists and their feet and ankles. They just look very inflamed, and this is due to that joint having a lot of inflammation. So we have arthritis, then there's a good example for the healthy, and then having osteoarthritis looks like. So it's a degeneration of that joint cartilage and the underlying bone, and it's commonly associated with previous injury, obesity, or sedentary behaviors. So it's an end result of a lot of these disorders. And right here on the rheumatoid arthritis, we see how that starts to affect the actual bone and the joint around it gets inflamed. So yeah, like we said before, it's chronic and progressive and causes that severe inflammation and pain. And this causes people not to have a really easy time being mobile. So we can see how this can affect people who are a lot older later. So physical activity and arthritis. So it's recommended for all forms of arthritis. Use moderate, low intensity, low impact lifts and aerobic work, longer warm-ups and cool downs periods, and include pool work if possible. So the pool is actually really good at helping you move your body with lowering that impact. So that's what that's useful for. Exercise can improve function, joint pain, and swelling. All right, physical activity and mental health. So exercise can be effective as medication for mild depression or anxiety. Frequently exercising is important for this. So non-stressful exercise can increase dopamine, serotonin, and endorphin activity. So these hormones that do cause good feelings in your body will be increased due to exercise. It's going to provide positive psychosocial elements and improve mood, self-esteem, cognition, and stress management, which we definitely need for those cardiovascular health of our body as well. So physical activity and neurodegeneration. So we have Alzheimer's disease, Parkinson's disease, and dementia. So physical activity will be a benefit to these diseases. Basically, you're going to have a lot of intellectual stimulation and social engagement. Proper nutrition is going to help with these diseases. And obviously, engaging in the regular exercise will help prevent this from getting too degenerative. A lot of it can be caused we obviously don't know why exactly these things happen, but if someone suffers from diabetes, they have sugar, like excess sugar in their body, sugar can also go in their brain. Basically, they've said Alzheimer's is having like sugar in your brain. So if we can just cause this to lower through nutrition and exercise, it's probably best for you to do, while you're younger. So the physical function and brain neurodegeneration are directly linked. Activities to help maintain at least baseline levels of activity might help mitigate progressive disability. So Alzheimer's disease causes progressive, irreversible mental deterioration, memory loss, diminished cognition, and eventual loss of independence due to brain degeneration. Parkinson's is like when someone has tremors, muscular rigidity, and slow and precise movement abilities, and it's associated with basal ganglia degeneration and dopamine deficiency. And dementia is a chronic disorder of various mental processes caused by brain disease or injury, which is characterized by memory disorders, personality changes, and or impaired reasoning. So it's just a deeper dive into these things in case you guys didn't know what they were. And that's it. So, again, a quick reminder, we will be meeting in person for the first time on um, February 3rd, Monday, and you will not have class on Thursday at all. So you guys can get through these videos as you need to throughout the whole week. uh, do need you to complete homework two, if you haven't already, homework one, and your unit one exam on NCFS. I showed you guys how to get to that. You're going to go to the study section, click on the personal training materials, and once you get through each one of these sections where you see it on the left bar, you will go towards the bottom of that left bar to get to the unit one exam. Again, I can see if you completed it, but I will have something open on Blackboard where if you would like to take a screenshot or picture where it does say Unit 1 exam on the top and the score, so that needs to say the percentage and how many you got out of whatever questions, how many questions was, I believe it was 12. So if you want to submit it that way through Blackboard, that's fine. But hopefully you guys used your FDU emails and your first and last names, and I can just look you up if you don't put that up. Um, but yeah, I will see you guys on Monday and enjoy the rest of your week.